We now return to the State Journal's Decision Makers.
And welcome back. Congresswoman Shelley Moore Capito, West Virginia's 2nd District, a Republican, and just a wonderful person.
Oh, well,
thank you for being here. You know, I was actually looking up a little bit. I found out by looking at your website, you now have a 2-year-old granddaughter.
I do. We do.
She's at 2 years old. She's probably starting to be a pretty interesting person.
She is. We babysat for her for the weekend 2 weeks ago. She's a lot of fun.
Oh, great. Let's talk about health care.
Okay.
Supreme Court could be tomorrow when we get up on Monday morning, or certainly the following Monday, but in the next 10 days it looks like they're going to rule on the legitimacy of the health care bill, the Obamacare as it's known by some. What are you there? I mean, these are well-guarded secrets, I guess. I mean, nobody really knows except for those guys.
Yes, nobody's tipping their hand except the observers who watch the formal arguments before the Supreme Court. You know, one of 3 things can happen. They can leave it alone. They can throw the whole thing out. The general consensus is thinking that if they make a more affirmative decision, it would be to throw out the individual mandate. In other words, it would be against the Constitution for the federal government to mandate to a private citizen that they must buy something. And it's all about the Commerce Clause. I'm not a constitutional lawyer, so I can't interpret it, but you know, we talked about this when it was up for passage. I don't see how you mandate to an individual that they have to purchase something or pay a penalty. If that happens, I think there'll be chaos. We're predicting chaos anyway because it will be a monumental decision.
Either way. Either way.
And it's a decision that has to be made, not just because it's going to influence health care. It's going to influence any kind of product moving forward. So I think the good things that have already moved forward that we agreed on, that are in the Affordable Care Act, children under 26 on a parent's health insurance, not being able to be disallowed because of pre-existing conditions. Other things that are already into effect will move forward.
But weren't those things, I mean, here's the part I didn't understand. I thought there was pretty consistent agreement on those kinds of things.
Absolutely.
And what I don't understand is, why couldn't we put those things in? And then I'm still concerned that we haven't done anything to lower health care costs. I mean, the costs are still going up.
Right.
And I'm going to throw one more question to talk about all of it. If the Supreme Court, you know, the law is written that says if you throw out any part of it, you throw out the law. What you said, or what I think I heard, that some are suggesting that somehow they're going to take parts of it out, but not the whole thing. Is that just because they're the Supreme Court?
That's just because they're the Supreme Court. That's what my attorney friends are saying. The Supreme Court can make that decision they felt like. You know, when we first started approaching this, we all know the healthcare system's broken. We know that there are people that can't afford it. Small business owners can't afford it. Individuals can't afford it. Young people can't afford it. And so, insurance, and so they're not getting access. So, you know, we knew this existed, and so we did have areas of common agreement between practically everybody on Capitol Hill. But the President chose to really push forward with a very broad-reaching, far-reaching government-sponsored health care, basically. And this is where we are, and that's where we parted ways. And so, you know, when you're talking to small business owners and they're saying that you know, they're considering dropping coverage because paying the penalty is less. So that means your employer-sponsored health care is going to go down. Your private pay is going to go down. And every health facility and physician in the Valley can tell you that that's not a good situation because they're under-reimbursed in all these state and federal programs. So then, you know, but we didn't do enough. We haven't done enough for costs. You know, repetitive testing. Tort reform could have been in there and had a great effect at a federal level.
And that is a huge deal.
It's huge. I mean, it's billions.
Yeah. On a national level, it would change the way the game's played. And it would, what it would do, the other part it would do, it wouldn't just take away some costs. you know, we all get a million different x-rays
Right.
over the course of a lifetime that expose us to cancer and other things that we wouldn't have to have if these guys weren't afraid that they're going to get sued if they don't do it.
Right, they're practicing defensive medicine. Or if you have one test for instance, my parents down here in Charleston, take them back to Glendale, same test the next day. It's a total waste in 24 hours. And so, you know, there's a lot of ways that electronic medical records should be able to alleviate that issue. Tort reform would certainly help with defensive medicine, but those choices were not in that bill, and regretfully so.
If the Supreme Court overturns the legislation, will there be like an attempt to have an emergency kind of addressing of health care, or given the politics of today and the fact that the House and Senate are different parties and an election going on, is that something that would then just be pushed back until the next session?
I think it depends on how they interpret it. I mean, I believe what's important is for the things that have moved forward, that people, and I've mentioned a few, that people are already accessing, and insurance companies have adjusted to, health professionals have adjusted to. I think if those get carved out and are able to move forward, then I think we won't address it. But if those things go down with the decision by the Supreme Court, then I hope that we come back quickly and reinstate the things that we agree on. And I think that would give people a lot of confidence that we could do something like that in a short period of time. We already know how to move it forward. So it's really hard to tell until they make their decision.
I almost heard you say that we might do under pressure what we should have done the first time, is find the common ground instead of trying to ram it through.
Right.
All right, we need to take a quick commercial break. We'll be right back on the State Journal's Decision Makers after this.
Don't miss the 9th